Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Happy Friday. It is 9 o'clock on Friday, and you are watching me, Deb Burton, Executive Director of RI Elder Info, and your host for Friday Friends, where every Friday we bring you information that you or someone you know needs to know about. So make sure you hit the like button, the share button, the bells, the whistles, all those social media cues to let folks know that we're talking about stuff that somebody you know needs to know about. Also, if you get a chance, hit the follow button. We are at almost 2,000 followers. Would love to see us reach 2,000 before the end of the month. So all of those things I am extremely grateful for your support for. And as you all know, we are a 501c3 nonprofit, and we could not do this without the support of our sponsors. So a huge thank you to Point 32 Health Foundation, United Healthcare, Oak Street Health, and of course, our Friday Friends supporter, McCarthy Law. Here's a moment with McCarthy Law.
Here at McCarthy Law, we practice in the areas of estate planning, long-term care planning, elder care law, and residential real estate. Our focus is really on providing peace of mind to our clients.
If you're interested in scheduling a consultation with our office, you can feel free to reach out to us at 401-541-5540. You can also reach out via website at www.mccarthylawri.com. You also should check out our social media, both on Facebook, Instagram, and LinkedIn for some helpful tips and tricks.
So I recently had the opportunity to spend some time in one of our hospitals here with a friend of mine, and I had the opportunity to meet other patients. I got to interact with a lot of the care teams, and it really made me aware that there are some things that we need to think about when we or a loved one are getting ready to leave the hospital. So I wanted to give you 7 things to consider when you discharge from the hospital. So the first one, what are you able to safely do on your own? And what will you need help with? So when you first come home, of course you're tired because, well, hospitals work 24/7, so you probably haven't slept a whole lot. So what are the things that you can do when you get home? So maybe you've been in the hospital for a few days. Is the milk in the refrigerator still good? Or maybe you could have a friend or family member do a grocery run for you instead of adding that to your things to do just as soon as you get home from the hospital. Are you able to get in and out of the shower safely? If not, what is your plan for being able to wash up and get dressed? What is the plan for preparing meals? You know, friends always say, how can we help? What can we do? You know, it might not be the giant platter of food that you need. It might be the individual plates of food that are just kind of prepared ahead of time. You can pull out of the refrigerator and microwave to make it easier for you when you first get home. Little things like that. You want to have those conversations and think about that as you're getting ready to discharge from the hospital. Now, you also want to think about, okay, maybe some of those things are really challenging to do, and the hospital is recommending a subacute rehab facility to regain your strength. And you're saying, I don't know if I know what a subacute rehab facility is. Okay, so couple different kinds of rehab facilities. The first would be acute rehab. So you go from the hospital to an acute rehab facility where you are participating in physical therapy, occupational therapy, speech therapy, many hours of the day. It is very rigorous. From there, you may be able to step down to what is called a subacute rehab facility, which is more of the rehab unit of a long-term care facility where you can also get physical therapy, occupational therapy, speech therapy, but it is not as intense for the duration as acute therapy. So you really have to think about what is your stamina, what is your capability as you're discharging, to figure out what is the best facility fit for you. Now, little unknown piece of information, science says, there's some research out there that says for every day you spend down in the hospital bed, okay, not getting up, not moving around, it takes you 8 days to get back to where you were before you landed in the hospital. That's not saying for every day down, it takes you 8 to get back to normal and good. No, it's to get you back to where you were before you even entered the hospital. So you want to think about that when you're getting ready to go home and you're thinking about whether or not you need to go for some rehab, that it's going to take a little bit to get to where you were from before you went to the hospital. And the reality is you want to get better than what caused you to go to the hospital. So you want to think about those things. You want to figure out, will you need home care services? You know, a nurse that visits a few times a week, or maybe a home health aide. Where are you located in the state, and what is the staffing capabilities? Now, I've mentioned before that there's a healthcare workforce shortage. It is true everywhere. So home care under your Medicare benefits or under your health insurance is not going to provide you 24/7 care in the house. Hospice does not provide 24/7 care in your house. So you really want to put together your care team, your support system, your friends, your family to kind of meet all of your needs for when you go home. You know, and I mentioned Medicare does not cover long-term care. I feel like I need to say that again. Medicare does not cover long-term care. So you may have a visiting nurse that's going to come out for a short period of time under Medicare, and Medicare will cover it. But if you need care that is ongoing, Medicare does not cover that. Now, you can still receive care. You can hire a home care agency. You can stay in the facility if you've discharged to a facility. The question then becomes, how do you pay for it? And that's part of a conversation that we will have on a different day. If you'd like to have some information on the different ways to pay for care, it is on the RA Elder Info website under Paying for Care. So when you're discharging, do you have the needed supplies? And if not, where do you get them? So do you have the right bandages, the right wraps, the gloves, say the incontinence products, if you have difficulty getting to the bathroom right away? Do you have those things all ready? If, say, for instance, nutrition is an issue, and they say, oh yeah, you need to drink the protein shakes. Well, do you have the stuff at home to make the protein shakes? Are there things that you need to get that are not something that a pharmacy can necessarily deliver? So you want to think about that when you're getting ready to discharge. Do you have the equipment that you will need and the space for it? So, you know, grab bars, things like that, that is something that is installed into the framework of the studs in the house to make them secure. And there's different ways of paying for the home modifications, and we'll talk about that on a different day. But when it comes to, say, a hospital bed, do you have somebody who can move the furniture that's already in the spot where the hospital bed is? Can you get that coordinated ahead of time so that you're not worried about, you know, coming home from the hospital, just trying to get a good night's sleep, but now you've got to figure out, okay, how am I moving the furniture? How am I moving my side table, you know, next to the bed so that this hospital bed can come in? Where does my bed go? They tell me I can't have throw rugs. So who's going to roll up the rug so that I can be safe? You want to have those conversations before you discharge from the hospital. You also want to figure out, do you have transportation to get to the follow-up appointments with your doctors that you need? Now, we have a whole section on RA Elder Info on the different transportation options that are out there. And we have the program, the MTM transportation system, which provides free non-emergency medical transportation for individuals on Medicaid, as well as if you are not on Medicaid, MTM also covers the elderly transportation program, which there is a fee each direction. And I'm sorry, I forget if it's $2 each way or $4 each way, but it is a per leg cost. So it's not a lot, and the driver will collect it, but it is something that you want to think about as you go forward. Now, if you need transportation to more places than just your doctor's visits, you might want to look at, say, the ride transportation. Of course, you've got your traditional Uber, Lyft, taxi cabs, those kinds of things, but you want to make sure that they're going to meet your needs effectively. And you want to do that before you discharge from the hospital. The case managers can help you explore all of your options to get these questions answered before you go. Because remember, when you first get home, you're going to be, kind of tired, maybe a little stiff, maybe, just so glad to just be in your own environment. You just want to rest. Don't forget, if you rest too much, you rust. So you got to keep moving. You got to keep going. But you want to make sure that you're doing it safely. And how can you do those things safely? By thinking about these 7 different things to prepare as you're discharging from the hospital after a medical event. So I hope this was helpful to you. If you have any questions, any concerns, you can always call me or email me. Of course, you can find lots of information in regards to different ways of paying for care, what documents you might need to gather if you were going to apply, say, for Medicaid. You can find that all on the rielderinfo.com website. If you found this information helpful and you want to help pay it forward, please feel free to hit the donate button, and it will allow us to help people going forward. So we appreciate you watching us today. I hope you hit the like, the share, the comment button, because right now our hospitals are jamming. So I know that there are a lot of people who really need this information for themselves, as well as the caregivers too. So thank you all for joining. I look forward to seeing you next week. In the meantime, be well and be kind.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.